So welcome and thank you again for joining us at our Tuesdays at 10. We are going to talk to you today about hormones and how they affect the skin, all the different challenges that we are going to see. So unfortunately, we won't get through absolutely every hormone and every challenge because it's a big topic, but we've narrowed it down to our main ones that we will see coming through our doors and how we're going to be able to fix that. So we're going to look at hormonal pigmentation because I know that that's a really big hot topic for everyone. And then we're also going to look at hormonal acne and menopause. How is menopause affecting your client's skin? What are you seeing come through the doors? Pop down in the chat what you are seeing come through the doors and how you are approaching it at the moment, or maybe some of the struggles that you're having as well. I do have our lovely Kim with me today. Kim is monitoring the chat. So if you do have any questions, feel free to pop that down and Kim will respond or ask me the question to be able to answer for everyone today. If you are putting anything in the chat, if you can also change that to the host and everyone, so that way everyone can see your question, because it's more than likely other people are having that same question as well. And then we can all share and learn from each other. So I think everyone has joined us now. So let's get started. So let's look at hormones and how they're affecting our functioning of our skin. What are the changes that we're seeing come through our doors, and what are our clients facing? So when we look at hormones and the influence of the development and function of our human skin, what we're seeing is changes in these hormonal fluctuations as well. We want to have a look at what are the specific hormones that are changing, what are the specific increase or decline, and then what is it causing? So a lot of the times we can see changes with menopause and puberty. We can also see when we're taking birth controls now, the different medications are also influencing the changes in the skin as well. And what's happening with that process? How is it being eliminated? What is the changes that it's then responding to the different cells and the different target zones? So let's go through a few different hormones that we would typically be seeing. So these are our most common ones that we are going to be seeing affect our skin. And when we look at this, we've got our estrogen, our progesterone, our androgens, and our cortisols. So these are the ones that are going to give you those biggest changes in the function of how the skin is working. So when we look at our estrogen here, we're going to stimulate our collagen, our elastin, our hyaluronic acid. It's going to give us that firmness, that mattress and support in that skin. So when we're looking at that aging and the wrinkles and the lines, the estrogen is going to be the one. If there's a decline in that, that's where we're going to see that take that its biggest role. And then progesterone. So this hormone is going to increase oil production. It can lead to acne and oily skin. So sometimes we can see that taking a bit more of a focus in that puberty stages as well. So we'll break all of these down a little bit further for you. And then androgens. So this is really going to look at the sebaceous growth, hair growth. So sometimes we can see excess hair, especially along that jawline for some of our clients, or the hair, the lip as well. It can also affect wound healing and that homeostasis response in our skin as well. So we really want to look at that barrier function and keeping that nice and strong and healthy. And then lastly, we're going to look at cortisols as well. So this is produced in our adrenal glands. So this really helps control those stress levels. And I know that's a huge thing at the moment. Our stress levels are all over the place sometimes, and there's many factors that can affect what's happening with that. But cortisols can lead to inflammation, things like acne, eczema, anything that's producing that inflammation in that body. So really helping to calm and reduce our cortisols can show big improvement in our skin and the functioning as well. So things even like better sleep is a huge one. So let's have a look at how we can also monitor that. So when we have a look at this little diagram here, and this is sometimes a little bit overwhelming to look at, but this is just hormones and they're influencing the development and function of the human skin and how it's releasing those different hormones. So When we have a look through here, we've got our keratinocytes, we've got our sebaceous sites and melanocytes, dermal fibroblast sites in here. We've got all of those little things that are helping that good, healthy, strong, functioning support of the skin. So when we are having a look at understanding how these hormones are affecting what it's doing on the skin, we need to know what is its target and what it's stimulating. So you can see the endocrine system plays a really big role in a lot of these different ones, our androgens as well. We really want to make sure that we've got to remember as well, we're still therapists, so we are not doctors. So if there is a hormonal imbalance, we do still need to refer them on and make sure that they are getting the correct treatment to support their skin and get that functioning correctly. But what we can do as therapists is we can manage those symptoms and help just see, have they had their hormones checked? Are they do you think that there could be an imbalance, and then potentially refer them on to get that proper check and diagnostic tools done, so that way then we can treat it more effectively as well. So we also need to remember to stay in our scope and line of work. We can't diagnose our clients with certain things, but we can help them identify and get the right help that they are needing. So when we look at our hormonal effect, some of the things that we're going to see on the skin here is we're going to see melasma and chloasma, pregnancy mask, menopause, HRT, and oral contraceptives. So these things are really triggering that pigment effect. So when we are really seeing pigmentation changes in the skin, these are some of the things that could be triggering it. So we're going to really now start to break down pigmentation and remember where it's coming from, what are the causes of it, and then how can we treat it and work more effectively in there. So if we have a look at melasma, I think hands up, this is the biggest one that you're seeing come through your door. It is the hardest condition to treat because people treat it the wrong way as well. So we're going to look at how we can treat this really effectively in here. So it is a hormonal imbalance, and it's caused by our melanocytes. So when we have a look at and break down what it's doing in the skin and how it's working effectively, or how to treat it effectively, then we're going to get a better end result for our client. So when we look at melasma, it's specific to facial pigmentation. It's generally that butterfly effect. It's symmetrical as well. So if you see it on one side, it's usually matching on the other side as well. It usually is like a little patch, what we call that butterfly or that mask-like effect, because it usually affects that area or across that top lip as well. It's often referred to it as the mask of pregnancy. It's usually caused by a combination of hormones, medications, sun exposure that has triggered it. And once it's there, it's there. So you maintaining those, you're helping to treat it, but we can never get rid of it. It can constantly be re-triggered all the time. So when we are having a look at identifying this, sometimes it's underneath and you can't really see what's happening. But talking to your client and getting that, doing that really detailed consultation for your client to find out, okay, when did this happen? Did this happen when you, during pregnancy? Did it happen during puberty? Did it happen when you started taking a medication? A lot of the times it does tend to go away or reduce greatly once those things have stopped, once their hormones have gone back to normal post-pregnancy, once they're off their medication, but they can be triggered again. So we're going to have a look at how we can help with these conditions as well. So we're going to go take a little bit of a step back and understand how melanin is being produced and break down that little bit of that skin science, because we really do want to understand what we're working with here. So when we're looking at our melanocyte, that's in our basal layer of our epidermis. So a lot of the times when people are treating it, they want to go way too deep and past our target. So it's remembering where is your target zone, because things like if you're needling this to try and break it up and you go 1.5 to 2 because I think it's so deep we need to go further, you're missing that target, and then you're wasting what you're doing, and then you're having this longer wound healing response time and you're not treating it effectively. So really understanding we are working in that basal layer of the epidermis with when we're looking at this. So we want to sit at around that 0.5, 0.6, sometimes even 0.4, depending on the level of where the melanin is. But our melanocytes are 5 to 10% of the cells in our basal layer. So they contribute to giving us that protection on that skin. So you can see here that we've got that little cell, and we call it our little octopus in here. And when those cells get excited, generally by sun, they squirt out little inks. So think of it like a little octopus squirting out little inks. And then they're adding their little pigment cells into all of those other cells around it, which then darken. So when we get into the sun, we produce more. And same thing that when we are on, our hormones are changing, if we're on medications and things like that, and we're getting that inflammation is causing that trigger of cells to produce. And sometimes that can be quite uneven. So therefore, we need to help to reduce that inflammation as well, especially when we do look at melasma, because melasma is caused mainly by inflammation. So the purpose of our melanin, so when we've already spoken about this a little bit before, but it is to protect our cells. So when we see that sun or that inflammation, our body produces this melanin to work at protecting that cellular layer, but sometimes they can produce unevenly. So think about that little umbrella that's being produced to protect and cover, but sometimes it can be overproduced. It can be produced in not uniform as well on our skin. So we want to make sure that we are looking after that and maintaining it. Now, especially when we look at doing treatments and peels and things like that, and modalities, you'll often hear us talk about using tyrosinase inhibitors, and tyrosinase inhibitors are essential. So when we look at a tyrosinase inhibitor, it is helping stop that enzyme that is producing that melanin in the skin and controlling it. So when we have a look at our little chart through here, we have our little process of melanogenesis, and this can get really overwhelming. And I do have a smaller version of this coming up soon, which is a little bit more condensed. But we have our tyrosinase, which is an enzyme. So the enzyme here that is being produced. So we start with our tyrosine, which is the amino acid. We go into our tyrosinase, which is the enzyme, which then goes through oxidation, which then goes through dopa. And then you can see that little process that continues on. And then it comes in with our pheumelanin or our eumelanin as well, which is then produced on our skin. Now, when we look at a tyrosinase inhibitor, we are stopping it in its tracks. So we are putting tyrosinase inhibitors into the skin and helping stop that overproduction of melanin from being formed. So we are stopping it at its level of where it's starting, not at the end where we're trying to lighten it and get rid of it. We are helping to control that production from the beginning. So when you have things like you're doing treatments on your client and they've got a darker Fitzpatrick, or they've got pigment issues to start with, say they've got melasma, then we want to have as many tyrosinase inhibitors as we can to control that better outcome for our client. So when we are doing a treatment that's causing inflammation, when their hormone levels are spiked, we are stopping that to overproduce. So we really want to make sure that we've got that under control from the beginning. Otherwise, you're going to fight a losing battle. So when we look at the hormone melasma connection here, so there is no known cure for melasma, unfortunately, but what we do want to do is find out what are some triggers, how can we help stop a lot of those triggers from occurring, and how can we control it that little bit better and work with it a bit more. So women of reproductive age are most likely to be affected by this. So usually when they are going through those hormonal changes and they're getting those spikes, that's when we are going to be seeing that a little bit more. It's most common during pregnancy. So unfortunately, we can't really do a lot through there in terms of treatments during that pregnancy, but definitely we want to look at our sun protection and having those tyrosinase inhibitors that are completely 100% safe to use during pregnancy. We don't want to look at peeling and things like that. We want to wait for those hormones to go down, and we might actually be able to then treat it more effectively afterwards. We do usually see this in people with darker Fitzpatricks because there's a lot more melanin being produced. They usually do see that a little bit darker, but it's not to say I've seen a lot on a skin type 1 and 2. So they're not excluded from it at all. You still will get those skin types 1 and 2 with melasma. sorry, pardon me. So a lot of the times you'll see this either called cloasma or the mask of pregnancy. Most of the time after they've hormones have gone back down after pregnancy, it usually goes away and not usually triggered that much unless they've been in a lot of sun afterwards, but usually it will go down quite a bit. A lot of the time you'll see it on young women as well who are on the oral contraceptive pill. So that is another indicator as well. So if they have just started taking the pill, that can cause this. So there is not one pill that's better than the other. It's, you know, everyone is different, but unfortunately that can trigger a lot of medications. So about 10 to 25% of people will suffer from this who do take oral contraceptives. So unfortunately, there's no way of knowing who is going to be that person in that percent group that will be affected. But it is, for me, that's quite a high percent, 10 to 25% of people. And there is also a connection between this and the thyroid disorder as well. So when we look at the thyroid as well, that's a big hormonal indicator as well of sometimes different conditions that you'll see in the skin. So we'll talk a little bit about that a little bit later on as well. And anyone who is in the sun more, so the sun protection, you can't recommend it enough. It does absolutely everything for the skin. So if your client is not wanting to wear their sun protection, then it's really hard to treat anything effectively and also preventative. So please make sure everybody is being cautious when in the sun. And I know you're all very good with recommending that to our clients, but sometimes we do have a few non-compliant clients that we don't tend to be that happy with. But let's have a little look at some hormone stats here. So 50% of pregnant women develop hyperpigmentation and 10 to 15% of people develop melasma. So sometimes melasma gets misdiagnosed again. Sometimes it's right under there. So having things like your scanning systems as well is really good at being able to determine that. And I do have a couple of helping you determine them in a couple slides coming up. So we'll just hold that bit for a second. But usually it's typically on the cheeks or the forehead. Like I said, it's that real butterfly, it's uniformal on the skin, and more common in women that are Latin and Asian descent because they do have that darker Fitzpatrick, that higher Fitzpatrick level. Can also be caused by the use of hormonal-based medication, which we had said previously, 10 to 25% of people who are on any contraceptive or any hormonal medications can have that spike in it. If we have a look at medications here as well, so you will find that drug-induced pigmentation can range in color from brown to a grayish blue. Sometimes it's not that true light brown freckly-like appearance. It's more of that really darker color. And some medications can also cause photosensitivity. So when we do have that photosensitivity in those medications as well, it can not only cause pigmentation, but it can just cause your skin to be more reactive. It can cause treatments that you're doing as well to have more of an inflammation response, which that can then lead to pigmentation as well. And most times once you have stopped your medication, the pigmentation will go back to normal. So that is the best outcome that we want. But we usually sometimes have to give that a good 3 to 6 months post-medication for the skin to go back to the way it should. So some medications that can increase this skin sensitivity to the sun. So we have things like our birth control, hormones, antibiotics, anti-inflammatory drugs, and cortisones. So anyone who's on any of these, and when you're doing your consultations and they tick yes to any of these, have a little, ask a few more questions. How does their skin feel when they go into the sun? Have they noticed any more pigmentation that they didn't have before? So all of those are going to be little clues to what is happening in the skin and potentially how we're going to be treating it. So if we're looking at pigmentations and our diagnostic response, so let me know in the chat if you do have a diagnostic system. Is it a skin scanner? Is it a Woods lamp? Is it just you having a look with your hands and eyes and touching and feeling and questions like what is everyone doing at the moment in their skin scanners? So when you do have these diagnostic approaches, they're a really good indicator into seeing what is underneath. And especially with melasma, it is so hard to see on the surface because it's usually hidden underneath the skin. And sometimes you don't see it until you've started to do a treatment. And then you're like, oh, hang on a sec, where did that pigment come from? So if we are looking at it under a Woods lamp, the superficial pigment, so what we're seeing is our freckles and our epidermal pigment, it's going to look darker. And then the deep pigment under the Woods lamp kind of tends to disappear a little bit, and you don't see it as prominent. So it's a bit harder on a normal everyday little Woods lamp for you to see it under. You really do need those photos deeper into the skin to be able to see it. So when we look at our epidermal pigmentation here, so it's visible under a Woods lamp, it's a darker brown, it's got well-defined borders, and it responds really well to treatment. So we know that this isn't melasma. This is more your topical sun damage, everyday sort of freckles and pigmentation that you're going to be seeing on the skin. So if you've got that pigment that is not shifting with your normal everyday treatment, it's more than likely going to be that more melasma hormonal pigmentation. So if we have a look, so you can't see it under a Woods lamp with this one. It's a lighter brown or a bluish in color. It has ill-defined borders, and it responds really slowly to our treatment. So if we're not being able to shift it with our normal peels or skincare, then it's more than likely it's got something to do with those hormonal triggers. So let's look at how we can work effectively with that. Some clients will have a really mixed pigmentation. So they might have a bit more of that underlying deeper pigment. They might also have a lot of epidermal pigment. And so you might see a mix here. You might see some responding well, but we need to have a look at, okay, let's shift this one here, and then let's go deeper and see what else we can do to treat it. So I did say that I had a much easier little diagram coming up now, but if we have our tyrosine, sorry, I've gone blank with my words here. I feel like it's Monday, but it's Tuesday. Plus our copper equals our melanin. So if we are inhibiting and using our tyrosinase inhibitors, they are going to block that enzyme from producing all of that melanin, and then we're going to be able to help stop and control that on that skin, and we're not going to get that overproduction of melanin being produced. Hands up if everyone is using a tyrosinase inhibitor with their treatments and their clients, especially in Australia with our sun and how damaging and how burning it is. We really want to make sure that we are looking after those clients. Even if they're a FITS 1 to a FITS 5, you still have to have that sun protection on there. If there's any pigmentation issues at all, the tyrosinase inhibitor must be used at all times. So if we have a look at some ingredients that are great for pigmentation, and especially for melasma, some of the ones here, we've got our kojic acid, which works as that tyrosinase inhibitor. You've got your daisy flower, which most of these are all your tyrosinase inhibitors in here. You got your daisy flower, you've got hydroquinone. Now I know we can't use hydroquinone as therapists, but it's still an option for some of those clients, and they can get that on prescription as well. We've got our tetrahexyl decylascorbate, or our vitamin C in here as well. We've got dipeptides in there. So peptides, some peptides, depending on how they've been formulated as well, can work to lighten the skin, brighten the skin, and also help protect it from UV radiation. And then we've got a hexylresorcinol 4 in here, which also helps prevent the skin from discoloration. Now, they're going to be our real big tyrosinase inhibitors and skin protectors and skin brighteners. But then there are also other ingredients that we want to use alongside these, which are just as important. So things like our UV and UVB, UVA and UVB. If we are controlling that pigment production with our tyrosinase inhibitors, but we don't have a sun protection in there, there is no point in doing it, because you're just going to repigmentate those cells and re-excite those cells at the same time. Now we have things like our acids and our retinol and our enzymes for exfoliation. The reason why we want to use these hand in hand with it is if we have, we're protecting those cells from, with our tyrosinase inhibitor, from overproducing. We've got the sun protection in there as well that is helping prevent any further damage and stopping that inflammation. But we still have all these pigmented cells. They need to come up and off the skin. It doesn't just disappear. It also needs to come up and off. So when we are using those acids and those retinols, what we're doing is we're exfoliating. We're getting those new healthy cells to reproduce. We're encouraging those other cells, those pigmented cells, from lifting up and off the skin and then stimulating those new cells. So we really want to work with those two hand in hand. They work really nicely together, and you can't really do one without the other. And we know everyone's skin level is different, so we don't always have to hit it with hard, strong retinols and strong glycolics. We can do gentle enzyme exfoliations as well if their skin is a little bit more sensitized as well. So don't always go aggressive. We want to really work with these skins and reduce inflammation as much as possible. So treatments that we can do and treatments we can't do. First of all, with melasma, we don't do any heat-based treatment. Heat produces inflammation. Inflammation will produce melasma. So things like IPL and lasers, and think RF and RF needling. If you were to do any of those on the skin, you might at first start to see an improvement, but that's because you're taking that top layer off. But then you're producing that inflammation underneath and putting that heat into there. So what's going to happen is that next treatment or a couple of weeks later, that melasma is going to come back with a vengeance. So we definitely want to make sure that we are not putting any heat and doing any heat-based treatments. So things like normal skin needling. Also infusing it with your mesotherapy products that are targeted for pigmentation, peels, LED, hydroexfoliation, and microdermabrasion. They're your best friends with melasma. They're the ones that are going to really start to see those results. So skin needling is probably my favorite, with infusing it with your mesotherapy products, because you're really helping to break that up, create that wound, get that new cell production happening, get all those cells working effectively. And then we're infusing those products down at the site where we actually want them to be working effectively. So that's my favorite thing to be able to treat melasma with, and the best results I've seen. But even LED, getting that skin cells healthy, stimulating that ATP, getting all those cells working really well together. I actually like to do all of these in combination and create a package, because I think that they do work well on their own, but doing a combined modality, and I think quite a few of you have heard my combined modality presentation. I really do love combining different things together, starting maybe with peels, getting that top layer of the skin off, building the strength of the skin, building the strength of the skin with the LED as well. Then you can start some needling and some mesotherapy, still do the LED with that as well. Microdermabrasion and hydrodermabrasion, you could do that before the treatments, you could do that after your series of treatments as well, and flood the skin with all of those actives that it needs, but also encouraging that cell turnover. So all of those treatments work really well either by themselves or fantastically together in a combined modality protocol. And you as therapists, don't be afraid to create different packages, because you tend to get bored. I know I did as a therapist. If I did the same treatment over and over and over and over again, I have that level of customization for your clients, and really being able to plan different series and see how their skin's going. Is it working effectively? Do I need to change it? Is also fantastic to be able to do that. So let's have a look at targeting hormonal acne. So hormonal acne is a hard one. It's a little bit of a challenging one, and it's one that we're seeing a lot of clients come through the door now, especially in their 40s and 50s now, with getting that stimulation happening in the skin. So when it comes to acne here, the androgen is in charge of the testosterone. So men and women both produce testosterone and estrogen in both sexes. We both need it, but women are more sensitive to testosterone in their body because they can't use it for normal function. So when we start to see changes and we start to see that hormonal effect, what we're doing is the androgen is in charge of our testosterone here, but as we age, our androgen levels decline, and then the testosterone doesn't get controlled, and then it can flare up. And then that's when we see that oil, that breakout, that congestion starting to really produce that little bit more. And then that sebum that it's producing can then get clogged in the follicles, and then bacteria can then be produced in there as well. And we start to get that blockage, and then we're going to see that on the skin. So what we need to do is we need to make sure that they are doing things to help control that oil flow, when unfortunately we can't control their estrogen levels. If they want to go and to speak to their doctor and get all of that under control, yes, they can. That can work really effective for them, but we need to have a look at what it's doing for the skin and how we're going to start to see those changes. So when we have a look at some of the causes of hormonal acne here, we see that change in our hormone levels in our women. So including and around your period time and irregular periods, pregnancy, menopause, we always get that little spike, don't we? Everyone knows when their period is coming because they get this little breakout coming through here, and it's always around, I know mine's on the side of whichever ovary I'm ovulating from at the time, I'll get that little breakout from there as well. But that's when you're going to see that little surge happen. So if we know, okay, well, this is happening at this time, we can start to take preventative measures. Maybe we could start to use something with salicylic just to make sure that that area is free from any clogged, our pores are nice and open, so the oils are going to flow freely as well at the same time. So sometimes men undergoing testosterone treatment as well, they've got more testosterone in their body, they're going to see those spikes as well happen. They might see a lot of congestion on their backs even. Some people will have a family history of acne in this, in their family history tree. They could have side effects of medications, so some steroids, and any pre-existing medical conditions as well. A lot of people with polycystic ovary syndrome, things like that, they're going to really see that level of congestion through there. So we really want to look at, okay, what we can do to help it. What are we going to do to reduce it? So we need to reduce inflammation. That's the biggest thing. We want to stop that redness. We want to stop that congestion from occurring. So things like exfoliating. We want to free that follicle. We want to increase that cellular turnover into the skin. We need to oxygenate that follicle and that cells. So we need to make sure that we are not blocking it. We want to put things like LEDs and things like that in there to increase or decrease that oxygen bacteria in the skin. We want to use non-comedogenic skincare, so that's really important. So what are they currently using on their skin? Is it something that's blocking, irritating, and then causing it to become even worse? Balanced nutrition. So not only for your skin, obviously we do want a balanced nutrition for the skin, and you'll hear us talk a lot about having a balanced diet for the skin and having everything, all those cell and nutrients and building blocks that the skin needs, but also what are you putting in the skin internally into your body? So are you on congesting foods and inflammation foods? So are you eating things that are causing congestion in the skin? Is it a lot of, maybe it's a lot of dairy, could be a lot of chocolate, or is it something heating as well? Strawberries are the biggest heating food that I know that inflame my body. So things that, looking at that heating and congesting foods as well, if you do want to know more about that, let me know, because we can share that information with you. But they're a big thing as well. What's your internal trigger? Birth control as well can, oral contraceptives like we spoke about earlier, that can be a big one at changing that hormonal level and causing that breakout. A sudden change in diet. I know it's just been Easter, so I'm sure everyone's having a little breakout at the moment from all of that chocolate that you've just eaten. But laser light therapy can also help at reducing any acne on the skin, reducing stress levels. Remember, we spoke about cortisol. Cortisol stimulates our fight or flight motion. So we need to make sure we're reducing those stress levels in the skin, and then that can also show and improvement and improve sleep habits. I know none of us are sleeping well. All of us have 10,000 things on their mind, and we're being overstimulated and we're on our phones till all hours of the night. So really helping to improve those sleep levels and getting that, reducing that cortisol activity as well will have a big improvement on your acne. So other things and ingredients that we're going to be using, things like salicylic acid, we know that works from the top down. It declogs that follicle as well and helps to reduce that oil production. So definitely glycolic acid is amazing for this. All of your other acids as well, your glycolic, your salicylic, your lactics are fantastic. Your benzoyl peroxide used correctly. So when we use benzoyl peroxide, it is fantastic at destroying that P. acne bacteria bacteria and reducing lesion count, but you got to be cautious with it. So try not to put it all over everywhere. Just use it as that spot treatment just on that one area, and don't use it for too many days in a row because it will dry and strip that skin. And that's the last thing we want to do, is compromise that barrier. Azelaic acid, I love azelaic acid, and it gets sort of forgotten about. But not only does it help kill P. acne bacteria, but it's anti-inflammatory. And anti-inflammatory is just as essential when we've got those clogged follicles and reducing that inflammation. It's also fantastic for that inflammation that's then going to cause that post-inflammatory hyperpigmentation that's even harder to treat. So have that anti-inflammatories in there when you are working with acne products, because that is going to be fantastic at reducing that PIH in the skin. Other amazing ingredients, ogleopeptide 10, retinol, lilac stem cell extract is fantastic as well, and our bakuchi oil, which is our plant-based retinol. They're also fantastic for treating more adult acne, because the bakuchi oil is so gentle on the skin, but it also helps to maintain that barrier function in the skin. So especially for someone who is more mature aged and they've got that drier skin, but they're having that breakout, you don't want to have all these drying and stripping products on there. So remember, if we're treating more hormonal adult acne, we need to keep that skin barrier in mind, because if we destroy that barrier, we are going to get even more breakouts from occurring because they're being trapped under that skin. So really look at keeping that barrier function. Fantastic treatments that we can use are facials, peels, extractions are really good. Do them properly. That's all I would say, is make sure you're extracting correctly and not causing it to rupture underneath. So being able to extract correctly. LED, IPL and acne rejuvenation. So if you do have an IPL system that does target acne, that is amazing for being able to use that. Ultrasound treatments and electroporation treatments to be able to infuse actives. So we may not be able to needle, we may not be able to do all those other treatments to put those actives in, but let's use ingredients that we can help to infuse those into the skin as well. So let's have a look now at our perimenopause and menopause. So during this time in people's lives, in our clients' lives, our estrogen levels are declining. And what we are seeing with our estrogen levels declining is we are seeing the strength and resilience in the skin to also decline and deplete. So we want to look at helping things like collagen and elastin. We want to look at protecting that skin barrier. That skin is going to dry out because we're not producing as much oil in the skin, and then we can get things like skin barrier issues, sagginess in the skin. So we need to look at what we can do to help fight all of those as well. So when we have a look at our menopause and perimenopausal effects, we can see redness, we can get hot flushes as well, and that can even give more redness to the skin. We've got that increase in capillary activity. We can have acne and hormonal changes. We're going to get loss of collagen. We're going to see loss of elasticity and get that sagginess to the skin. The overall dryness as well, because we're not producing all of those oils, the skin is going to dry out. And then we're also going to get more fragile and sensitized skin as well. So during the first 5 years of menopause, the skin loses roughly 30% of collagen. So that's a big amount to drop. So we really need to make sure that we are helping with that collagen and elastin production. So when we are looking at what we can do for that collagen and elastin production, we want to really look at that skin barrier first. We want to make sure that that skin barrier is perfect before we start putting other things into it. I do find ceramides are fantastic at maintaining those moisture levels into the skin. Antioxidants, stem cells, and vitamin C, they're all going to be really protective of the skin. They're going to really feed the skin, give the skin the nutrients and the building blocks it needs for nice, new, healthy support. And then we can use things like our retinols and our peptides in here to stimulate that collagen activity. We don't always have to go down the retinol path. So if our client is got more of that sensitive, fragile skin and they can't cope with retinols, then we do have our peptides in here that we could use our biomimetic peptides that will stimulate those results for us as well. We do want to have our AHAs in here. We really want to stimulate that cell turnover, increase that cellular activity in the skin, and then of course UVA and UVB protection to help stop that breakdown of further collagen and elastin and melanin as well being overstimulated. But always think of the skin barrier first, because the skin's drying out, the skin's being more sensitized. So look at that first before you start doing all of those super high levels of activity into the skin and of treatments as well as products. Now, with our treatment options, some fantastic ones here are radio frequency. We've got skin needling, RF needling, facials and peels, LED and IPL skin rejuvenation. Now, all of these are fantastic to work together. Like I said, those combining of those modalities are amazing for being able to do this. And you're really going to be able to help to target those different layers with able to work on a different levels. So I love, again, combining, so doing a gentle peel first, then perhaps going into your radio frequency to stimulate your collagen and elastin, having an LED treatment as well. Remembering whatever modality you're doing, all of your different modalities and skincare products are all different. So I would always go back and have a look at their manufacturer guidelines or what that skincare brand suggests, whether the peel is first or the peel is after, because they are all made differently. There are all different strengths. So you need to make sure that you are using it in the best way. The guideline I give you may be different to the guideline your skincare center gives you. So just please make sure that you are following their guidelines as well, because the order of things may be different from what we suggest based on what we're using. But definitely we want to stimulate things like our wound healing in the skin. So whether that is done through radio frequency in a with creating no micro wounds or trauma to the skin, or you are using skin needling, depends on your client and what level they're at and how their skin is functioning, how healthy it is, how strong it is as well. So we always want to make sure that that skin barrier and biome is nice and healthy and strong before we then go into things that are going to increase the dermal volume, the skin lifting and the tightness of the skin. So I think that brings us to an end of our session for today. So I know that there have been a few questions, a few of them have been answered, but we are a little bit short on time today. So what we'll do is we will answer the rest of the questions offline and email them back directly to you, to any of the questions that we do have. And thank you for joining us for today. For those of you who aren't aware of the other webinars that we have coming up, we do have them all mapped out for the rest of the year. But like I said, if there is another one that you would like us to cover for you, please let me know. And we can look at creating one. But these are our next ones coming up. So next month we have how to build a peel plan, which takes us perfectly into our peeling season. So if anyone is wanting to know how to build a peel plan and using it with different modalities as well as peels, please join us for next month's session. These are all available on our website. So if you do want to register for any of these, all these links are already up on our website. So you can click these links and they will go out to you for the link to these. And then if you have any other questions, please let me know. You can email our team of educators at education@probeautysolution.com.au. And thank you again for joining us today. We've really loved sharing it with you. Thanks, guys. Bye.